Good morning to
Bom
all of you.
dia a todos e a
From
todas.
the
No
Inter-American
Banco
Development Bank, we
Interamericano
want
de
to thank you for
Desenvolvimento,
joining us
agradecemos-lhes
in
por
this webinar
acompanhar-nos neste
on
webinar sobre
adaptation
resposta de
responses to
adaptação à
climate
mudança
change in
climática em
health.
saúde.
My name is
Meu
Ignacio
nome é
Astorga, and
Inácio
I'm a lead
Astorga e sou
special in
especialista
health
líder
at
em
the
saúde do
LTD,
BID,
member of
trabalhando
the
na equipe de saúde e
Health
mudança
and Climate
climática do
Change
banco.
team at the
Para
bank.
ouvir a
To listen
conversa
to the
na língua de sua
conversation in the language of
preferência,
your choice,
convido-os a
I invite you
selecionar
to select
espanhol,
English,
inglês ou
Spanish, or Portuguese
português no
in the
ícone de
interpretation icon, which
interpretação que
is
está
at
ao
the
pé
bottom of
da
the screen.
tela. Podem ouvir a conversa em
Before
inglês ou
introducing our
português.
speakers
Antes de
today,
apresentar
I
os
would like to
oradores do
invite you
dia de
to a
hoje,
video that
eu
offers you a
convido-os a
summary of
olhar
how
vídeo que
health is
oferece uma
related to
síntese
climate
de
change
como se
and
relaciona
the
a saúde e
responses
a
we should
mudança
add to
climática
all health
e a
issues.
resposta que tem que ser dada pelo
After
sistema
that,
de
we
saúde.
will share
Em seguida,
experiences
vamos
from the region,
compartilhar as
from Chile and
experiências da
Brazil,
região do
and
Brasil
we
e do
will
Chile. Em
then
seguida,
have a
teremos
question and
uma
answer
sessão
session
de perguntas e
with some
respostas e umas
final
palavras finais
remarks.
de reflexão.
El cambio climático es uno de los grandes desafíos para la humanidad en el siglo
Climate
XXI.
change is one of the great challenges of the 21st century. To ensure the health of the population is key. And maybe you haven't thought of this before, but
El cambio climático es uno de los grandes desafíos para la humanidad en el siglo XXI. Asegurar la salud de la población es clave, y tal vez no lo hayas pensado antes, pero ambos están íntimamente ligados. Soy Ignacio Astorga, especialista en salud del Banco Interamericano de Desarrollo. Y juntos con mis colegas hemos preparado un documento que resume los principales hallazgos que relacionan cambio climático y salud. En este video te queremos mostrar los principales hallazgos. ¿Cómo se relacionan la salud y el cambio climático? El cambio climático puede afectar directamente la salud de la población a través de eventos extremos, tales como olas de calor, tormentas, sequías e inundaciones. En América Latina y el Caribe, 260 millones de personas se han visto afectadas y más de 90.000 han fallecido como consecuencia de estos fenómenos. De manera indirecta, puede afectar la calidad del agua, del aire, de los suelos, con un impacto ecológico significativo. Estos problemas afectan principalmente a los grupos más vulnerables, como aquellos de edad avanzada, en situación de pobreza, ruralidad o segregación. Finalmente, la combinación de estos tres elementos se traduce en una mayor incidencia de problemas de salud, tales como lesiones, enfermedades crónicas y aún problemas de salud mental. Segundo, el cambio climático está afectando la oferta de servicios de salud, tanto por los daños en los establecimientos como por la interrupción de los servicios. Anualmente, más de 3 millones de personas no pueden recibir atención por eventos climáticos extremos, lo que representa una demanda adicional que presiona un sistema que ya enfrenta importantes brechas de personal y recursos. Y tercero, el sector salud también contribuye al cambio climático y es responsable de más del 4% de la huella de carbono. El funcionamiento de hospitales y centros de salud representa solo un 25% de ella, y el 75% corresponde al funcionamiento del sistema de salud, en especial de la cadena de suministro. Frente a estos desafíos, es importante que el sector salud refuerce su resiliencia y reduzca su huella de carbono. Para fortalecer la resiliencia, es importante centrarse en tres elementos. En primer lugar, fortalecer los servicios, en particular las alertas frente a las emergencias, garantizando también la continuidad de los servicios esenciales. En segundo lugar, está la necesidad de fortalecer los recursos, de manera que sean resilientes, incluyendo el personal sanitario, columna vertebral de todo el sistema de salud, así como la infraestructura, de manera que sea un espacio seguro, tanto para trabajadores como para la población. En tercer lugar, están los directivos, de manera que puedan ejercer un liderazgo efectivo, tanto en la planificación como la gestión de la respuesta frente al cambio climático. Para reducir la huella de carbono, es necesario avanzar en edificaciones verdes y optimizar el funcionamiento del sistema. El cambio climático nos afecta a todos, pero en especial a las poblaciones más vulnerables. Es por eso que el sistema de salud debe y puede responder frente a ello, en particular fortaleciendo la respuesta de emergencia y garantizando los servicios esenciales en salud. Si quieres saber más, descarga la publicación completa en el siguiente enlace.
Thank you very much. We want to welcome the panelists to this webinar. Marco Horta, who will be the first presenter, who's the General Climate Emergency Coordinator in Health and Equity in Health from the Ministry of Brazil and works in the Osvaldo Fiocruz. He works in epidemiology, emerging and emergent situations and the effect of climate change on the population. He is a science. He's graduated in biologic sciences and environment. And Paola Contoni, who's head of the risk department in Chile for over 6 years. She's a nurse in training with a great deal of experience in assistance, education in health, and disaster risk management. She has a master's in care management, education, and risk management. So let's begin with Marco's presentation from the Brazilian Health Ministry. Marco.
Bom dia a todos. Prazer estar aqui. Vou falar em português.
Good morning. I'm thrilled to be here. I'm going to speak in Portuguese. We work at the Ministry of Health in Brazil. We have a coordination, a general coordination for climate change and equity in health, and that was established some 3 months ago, precisely to be able to work on specific actions focusing on populational health, and especially on the health of vulnerable populations in our country, given the direct and indirect effects or impact of climate changes. We have been hard hit by them. Ignacio, I'd like to share my screen.
Ok?
Okay.
Ok. Vamos para frente.
Let's go on.
Ok. Então, como foi colocado já aqui no vídeo,
as we saw in the video, excellent video, by the way, climate change have been hitting people's health. And since Brazil is a continental country, this country has been hard hit in different manners and on different fronts. We have had extreme events affecting especially the northern region of the country. And these events have had a major impact on our health systems that were not fit and adapted to welcome this high number of patients hit by climate change in the country. So basically, making a comparison, you see on the left of the slide the country that in the last 3 months has been hard hit by extreme drought. So even in extremely damp or humid regions, just like the Amazon rainforest, we have had very severe droughts. Fortunately, and this is a very good piece of information, this dates back to yesterday. Fortunately, rainfall is increasing in our country, and that allows us to hope for rain in the northern region. These pictures have been taken by our missions of the Health Ministry. Populations in the northern region, including the states of Amazonas, Acre, Rondônia, Pará, have been hugely impacted by the drought. This would be unthinkable some 5 or 10 years ago. The Amazon region has no rainfall. Waters have dried, brooks have dried, and the remaining water is not drinking water.
As regiões, boa parte das populações
Good part
fora
of
dos
these
centros urbanos da
populations
região amazônica,
away from
elas
urban
vivem
centers in the
praticamente
Amazon region
100% da água
live
próxima às suas
off
habitações.
the water
Então, essa
close to
água é
their dwellings.
utilizada
So
para
this
beber,
water
é
is used to be
utilizada para
drunk,
recreação, é utilizada
for
para transporte.
leisure,
Então, é
for
transporte de pessoas,
transportation,
o
so transportation
transporte
of
de
people and goods,
medicamentos, de profissionais da
transportation of
saúde. E
medication and
hoje a
health
situação tem
professionals.
encontrado
And
que
this
diversas
is the
localidades
situation we are faced
estão
today.
completamente isoladas. Então,
Several
com a
villages are
redução e a
totally
perda do serviço,
isolated
essas
because of
não
the
há como
drying
chegar.
of rivers and
O
brooks. You
segundo
cannot
ponto
get them
importante
to them.
nisso é que essas
The
populações
second
utilizam
important point is
poços,
that these
poços
populations
artesianos
use
de onde eles tiram a
wells,
água de
artesian
qualidade
wells, where
em
they
eventos de redução da
extract
água dos
drinking
rios.
water,
Acontece que os
given
poços
the
também
drying
secaram.
of the rivers. But these
E
wells also
os
dried up,
poucos poços
and the
hoje que você
few
tem com água,
wells
ela
that
não tem
having
qualidade
still some
mais
water
para beber. O outro
are not
ponto
fit.
que
The
também
water in
tem
those wells are
afetado
not is not fit
duramente o
for
país, e
drinking.
não só o Brasil,
Another
mas
event that has
diversos países
affected Brazil, but
fronteiriços
not
do
only
Brasil,
Brazil, but
são
also
as queimadas.
neighboring countries,
As queimadas
are
não é um evento
fires.
climático direto,
Fires are not
mas
a
os seus
direct
efeitos sobre a
climate
saúde são exacerbados por
event,
causa da
but their
extrema seca
effects
causada pelas
are
mudanças climáticas.
exacerbated because of the extreme
As
drought caused
queimadas
by
elas têm
climate
afetado
change.
duramente
Fires
a saúde das populações na
have been
região
affecting the health
amazônica,
of
tem
populations in the
causado
Amazon region,
elevado aumento nas
causing
notificações
a
de
spike
síndrome respiratória
in
aguda,
reports of acute respiratory
principalmente em
syndrome,
crianças
especially in
e
children
idosos. E boa
and
parte das
elderly
unidades
people.
básicas de saúde
And
em cidades
a
pequenas da
large
Amazônia
part
não
of
têm hoje
basic health
capacidade
units in the Amazon
suficiente para
region
receber
are
essa
not
população
fit to care
advinda
for this population
da exposição
suffering
aos
from
poluentes da
this
queimada.
exposure to
Então, esse
pollutants
é
from
um
the
cenário
fires.
trágico que hoje as
So this is a
populações
tragic
amazônicas
scenario
no Brasil elas vivem.
faced by the
As
Amazon
queimadas estão
population.
presentes em todo o país, com
Fires
milhares de
happen
focos,
all over the
com
country with
a
thousands
recém-chegada essa semana
of
das chuvas. Então,
points.
elas atendem
Fortunately,
a diminuir
rainfall
mais
has
os seus
started this
efeitos
week, and that
crônicos de
tends
ação
to
nas populações
decrease
que
the
estão dando
impact of
entrada em
fires.
síndromes
But we have the chronic
respiratórias.
impact on the population
Outro ponto
that
importante também do nosso país
has
que tem sido duramente
has
afetado
been impacted with
as
the
ondas de
respiratory
calor. Então,
syndromes. We
diversos
also
estudos
have
realizados
heat
no
waves.
Brasil mostram
Several studies
como os
conducted in Brazil
efeitos das
show
ondas de calor têm afetado duramente e podem afetar
how these
duramente
heat waves have
as
impacted,
populações
have severely
no Brasil.
impacted populations in the
Esse,
country.
esse estresse térmico,
This
ele tem
heat
sido,
stress
tem afetado principalmente a saúde
has
dos
affected
trabalhadores que trabalham
workers'
diretamente
health,
no campo,
people working
expostos
directly in the
à
field and
radiação
exposed
direta e ao calor
to
direto sem
direct
nenhum tipo de
radiation and
proteção,
direct heat without any kind
crianças,
of protection,
idosos e
children,
principalmente
elderly people,
desportistas,
and also
porque fazem suas
athletes
atividades diretas sob o ambiente abaixo da
who
radiação
are
solar.
directly affected by solar radiation.
Outro ponto também importante que tem sido
Another
percebido na
important
população
point
brasileira é a redução
that we have noticed in
substancial da
Brazilian
capacidade
population
de trabalho
is
da
the
população.
significant
Já tem
in the
sido foco de
population
estudos
work capacity
pela
that has
redução
been
da
the
porcentagem
object
de
of
horas
studies.
trabalhadas e
The
principalmente aos
number of
trabalhadores das
lost
regiões
hours has
norte
been
do
increasing,
país.
especially in the northern region of the country.
Além disso, tem sido também
Furthermore,
relatados fração na mortalidade por doenças respiratórias
there
que
has
advêm
been there have been
advindas então
reports
não só
of
das
death
queimadas no
assigned or attributed to respiratory diseases, and that I related to heat waves in different Brazilian cities. Populations are very vulnerable. A large part of the population is not resilient, or it is not adapted to face the extreme impacts of climate change in Brazil, especially indigenous peoples, which are the main concern of the health ministry. There is a special department for indigenous people's health because they have been severely impacted by these changes. And they are also isolated because, there are no water courses to get to them. Another phenomenon that has been noticed in Brazil is the impact of climate changes on transmissible diseases, even diseases that are not the focus of health care, such as acute respiratory syndrome and COVID. I'd like to give you the example of human rabies in a recently published study in Brazil showing that the likelihood of human rabies cases in Brazil is on the increase. Uh, Even though we have been able to eradicate the transmission of rabies through domestic animals, rabies today is only transmitted by bats, but because we have eradicated the transmission of rabies by domestic or through domestic animals such as cats and dogs, there has been a change in the various virus and the carriers. So human rabies is on the rise in the Brazilian continent. The same phenomenon has been seen in Mexico and in the United States. Researchers see a migration of bat populations to southern states in the United States, and that increases the risk of retransmission of rabies in the country. Another important point is tuberculosis. That's a condition that affects millions of Brazilians, and there might be an increase in the incidence of tuberculosis caused by climate change, given its impact on very poor and vulnerable populations in the Brazilian territory. Some initiatives have been taken, such as the heat wave platform to fight heat waves, but the health ministry has been drawing up an adaptation plan. We intend to adapt our more vulnerable population to climate change and how the health ministry can help them adapt. So we reinstated an interministerial committee on climate change under the presidency of the Republic in the current administration, ensuring governance for climate fairness. We have been drawing up a plan to mitigate and adapt Brazil faced with climate change or against climate change. We have a sectorial plan, a sectorial health plan to adapt to climate change. There were two workshops in 2023 and one in 2024, and there are other workshops underway. Basically, the plan being drawn up in the country, it's the climate plan based on the domestic policy on climate change. This domestic policy on climate change has two axes, one regarding mitigation and another one of adaptation. We want to have a domestic or federal strategy to mitigate the emission of carbon into the environment, including the ministries of agriculture, land use and forest, cities, urban mobility, energy and mining, industry, residues, and transports. We are in charge of the adaptation, or we are included in the adaptation plan. Even though the health sector is a sector that issues carbon, we are focused on improving health in the federal adaptation strategy for our sector. So the climate plan, focusing on adaptation, aims at establishing strategies to manage the public health system, to reduce the impact of climate change on people's health and on health services. And our basic care unit or primary care units and specialized health care. We aim at defining or drawing up guidelines to guide states and municipalities as well. So it's a plan focusing on people and the most vulnerable groups, including poor populations, indigenous peoples populations, black populations, and focusing also on the capacity of adaptation of our primate care units and specialized units all over Brazil. The central axis of the adaptation plan to climate change in health focus on health monitoring, basic or primary health care, specialized care to patients, health promotion. We want to foster or to raise awareness and knowledge about the impact of climate change, aiming at other kinds of target publics such as or target groups such as children and health professionals. And that of course requires investment in science, technology, innovation, and products that might raise awareness and knowledge, and products to adapt or to foster our health adaptation plan. So these actions have encompassed several workshops, technical scientific workshops with experts from dozens of Brazilian institutions, research institutions. Those experts have been debating this adaptation plan and indicators. Some 3 months ago, we established the General Coordination of Climate Change and Equity in Health, and I am at the head of this general coordination. And we also established the national or federal room of climate emergencies. We have meetings every day, and we debate the impacts of recent events, of recent extreme climatic or climate events on the health of northern populations, and we debate direct actions to counter these emergencies. We involve the populations, we transport medication, water, and foodstuffs. As I said, the plan also encompasses measures to foster scientific research, to come up with technical and scientific solutions for the mitigation and adaptation. This is an example of a public bid, a public call for Brazilian scientists to present projects to fight climate change in Brazil. The latest workshop was held last month here in Brasilia. And last but not least, the structuring of a general coordination of climate change and equity in health. This general coordination has different fronts, work fronts, focusing on epidemiology, monitoring of some climate determining factors, the provision or the forecast of events so that we can alert different secretariats of the health ministry, the emergency room, as I showed in the previous slide, that monitors the impact of climate events and in people's health, especially in the Amazon region, the Federal Adaptation Plan that I have already mentioned, that includes workshops and theme debates with Brazilian experts and scientists, and the health promotion and education. We develop materials to promote health, to guide people. And there is also the climate medicine, where health professionals, especially doctors and nurses, are receiving guidance about caring for patients impacted by extreme climate events, such as heat waves and extreme droughts. I'd like to thank you for the opportunity of sharing this with you. Ignacio, it's a pleasure to be here and to represent the Brazilian Health Ministry, sharing our experiences with you and learning also from you. Thank you very much.
Excelente presentación. Yo creo que nos abre un espectro
Thank you,
de
Marco. That was an excellent presentation. I think it
las
opens
distintas dimensiones que están
a whole idea of all the different dimensions you're working with the climate change effects. We've received several questions. It seems that people are all very interested. And we'd like to give the floor now to Paola Pontoni from the Chilean Ministry of Health. Paola.
Thank you, Ignacio. I'd like to thank you for kindly inviting me to join you. And again, it's a pleasure to be able to participate in such an interesting subject and have the opportunity to contribute to the discussion. I'll just share my screen now.
Ahí sí. Bien. Para nosotros como país,
So, for our
nos
country,
complace poder
it really is a
compartir con
pleasure to be able to
ustedes
share
cómo
with
se ha
you
ido desarrollando lo que es la
the
política nacional
efforts that have been
y
undertaken in
incluir lo que es la
developing
política sectorial para
national as
gestionar
well
el
as
cambio climático
sectoral
en Chile.
policies
Y
aimed at
nos vamos
addressing climate change
a
in
referir en
Chile.
forma
And
específica
we're going
a
to
nuestro plan de
focus
adaptación al cambio
specifically
climático sectorial.
on the efforts to address climate change and its
Bien,
impacts.
para comenzar,
So,
vamos a
just to
hablar un poco
begin,
de la
I'd like
ley
to
que
discuss
rige a Chile en
the national
cuanto a
legislation
cambio climático,
that governs the
luego de la
efforts in the
gobernanza
area
y
of
que
climate
está,
change, governance,
cómo se trabaja en Chile en relación
and
al cambio
how
climático.
Chile
Luego
is
vamos a hacer
responding
un
to the
acercamiento a
impacts
los
of
planes
climate change,
sectoriales
working in unison with various sectoral plans that have been implemented that are still awaiting formal approval. And we're also looking at some of the experiences in terms of the methodologies. The first implementation process began in 2016, and that we continue developing these projects. So in Chile, starting since 2022, we have climate change legislation in place, actually climate framework legislation. And our focus is to achieve carbon neutrality by 2050. That's our target, 2050. From 2020 to 2030, one of our commitments is to reduce CO2 emissions by at least 100,000 tons. Another overarching objective is adapting to climate change by reducing vulnerability and increases in resilience. Also, full compliance with international agreements already entered into by Chile in the area of climate change. And in fact, down below, we have the official legislation, that framework legislation published. And here we see one of the most recent ECLAC maps on covering the region of the Americas, showing exactly those countries that have formally approved climate change legislation, and Chile is counted among those countries. So looking at the climate change management instruments that are included in the framework legislation, we have, of course, the 2050 carbon neutrality agreement and targets. We have the NDC, which is our specific contributions at the national level and our responses, working jointly under the leadership of the Ministry of the Environment of Chile, and we are revising the NDC legislation to make sure that we can be on target in meeting with the objectives. And we also have the long-term climate strategy that includes both the goals and objectives at the subnational and sectoral levels. The Ministry of Health also has corresponding targets for the medium and long term, but they need to be aligned with the adaptation plans, the sectoral plans, and they need to be aligned with the National Climate Adaptation Plan to encompass the entire country. That includes both private and public sector participation. And from this plan, we will be able to contribute to each one of the sectors listed here, ensuring full compliance. Similar to the situation that's faced by Brazil, currently we have 12 adaptation plans, and these have been delineated in specific projects. And we also have the mitigation plans listed here. We working with the health sector. It's also important to point out that the health sector is one of the areas where this isn't the first time they have developed a climate change adaptation plan. they have
y
already
ahora estamos
maintained a plan that
trabajando
was in
para un
effect since
nuevo plan de
2016. Now
adaptación
we're working
en
on a
que
new
está
adaptation
proyectado un
plan
nuevo quinquenio en
for the new
donde
5-year
estamos dando
period,
respuesta a lo que
and
nos
we
indica
are
la ley marco cambio climático, Consejo de Acción
responding to
Climática a
the
largo plazo.
stipulations
Y
within
dentro
the
de los planes
framework
de mitigación,
legislation. Now,
el
among the mitigation
cuarto que pueden
plans,
ver en el
number 4,
cuadro
as you
al
can
lado
see on the
derecho,
list on the right,
correspondiente a
refers
residuos,
to waste
es el
and
que,
waste
digamos,
disposal.
el Ministerio de Salud tiene a cargo el
This
plan de mitigación al
is
cambio
under the
climático
authority
en
of the
el sector,
Ministry of
digamos,
Health,
en residuos
dealing
específicamente,
with waste,
y es, digamos, en donde
and
estamos
this
trabajando
is
de
where
forma ardua como equipo,
we
como
are
Ministerio de
focusing our
Salud y con múltiples
efforts,
sectores
working together with
de
teams
trabajo
from the Ministry
intersectorial
of Health. So this
para
is an
poder llegar a
intersectoral
cumplir con
effort
las metas que nos hemos planteado.
to be able to fulfill and meet the objectives
Y en
that have been
cuanto a
proposed. Now,
cómo se organiza, cómo
let's look at
trabajamos, cómo
the
es la
organization
gobernanza para
structure as we
trabajar en cambio
address the
climático, según
governance
la ley
aspects
marco,
of
está
climate
definido en la
change.
ley,
According to the
está
framework
presidido
legislation,
por el presidente de la República.
the governance,
Existe
first
un
of all, is
consejo
headed
de
by the
ministros para la
president of our
sustentabilidad y
nation.
el cambio climático,
Then we
donde el
have
Ministerio
underneath
de Salud es
the
parte,
Ministry of Health
y
and the Ministry for
el Ministerio de Medio
Sustainability and
Ambiente, a
Climate
través de su
Change.
división de
Down
cambio
below that,
climático,
we have the Ministry
preside
of the
un
Environment, the
equipo
Climate Change Division,
intersectorial para el cambio
that
climático,
creates an
que es
intersectoral
el
working
ATIC,
group known as the
y que está
ETICC,
conformado por 17 ministerios, 3
including
subsecretarías, como bien
17
dice más abajo, y
ministries
10
and
servicios,
secretariats.
siendo Ministerio de Salud
We have
parte
the
de este
Ministry
equipo.
of Health as part
Y
of
el
that
Ministerio
team,
del Medio Ambiente
and
lo
the
asesora un
Ministry of
comité
the
científico
Environment
asesor para el cambio
also
climático,
has its
donde
scientific
el
advisory
Ministerio de
group.
Ciencias de Chile
The
tiene
Ministry of
una
Sciences
importante
is in fact
participación
a
y donde
major stakeholder
científicos de
where
diferentes
scientists from
universidades
various
digamos
fields and
que tienen,
academic
digamos, ahí
centers
una
are
importante labor para
playing
asesorar en
a
la
significant
revisión
role in advising
de evidencia
and using
y de la
evidence-based
responsabilidad
information.
también
They
de
also are
poder
responsible for
apoyar en la revisión de
supporting
instrumentos.
and
Está
reviewing
también el
the use
Consejo
of
Nacional
various
para la
instruments. We
Sustentabilidad,
also have
y
the
este
National
consejo
Council for Sustainability and Climate
lo vamos a ver un
Change.
poquito, digamos, en más detalle cuando veamos
We'll
los
look at
organismos
this
coayudantes también,
in a little more
pero
detail,
donde
but
podemos ver que es
here we see
un equipo no solo
a team
digamos, de
not
científicos,
only
sino que
comprising
también hay participación ciudadana de
scientists,
diferentes niveles.
we also have
Y los
participation
procesos
from various
participativos con la
organizations in civil
ciudadanía
society.
están también
We
indicados
have,
en la ley, donde
this has been
todos
stipulated
los
in the
planes
law,
actuales
where
deben
all
ser
of the
sometidos
current
a
plans
consulta ciudadana.
need to be submitted for consultation
Y a nivel
by
regional,
members of and
Chile
organizations in
está
civil
dividido en
society.
16,
Chile
administrativamente en 16 regiones.
is divided into
Cada
16
región,
geographic
además de
regions. Each region
digamos, de un representante del presidente, que es un
has
delegado
a
presidencial regional, cuenta con
representative
una
assigned by
autoridad
the president
electa por voto popular,
and
que es
this
el gobernador,
selected by we
quien
have the governor, for
está a
example,
cargo de
who
presidir
is
estos comités
tasked
regionales para el cambio
with
climático por él,
chairing various
y está
regional
compuesto por los
committees
diferentes
on
secretariados
climate
regionales,
change.
ministeriales,
We also have the
obviamente del Ministerio de
ministerial
Ambiente
representatives,
y de los
including the
otros
Ministry
ministerios
of the
que
Environment
están en la región y
and
que
other ministries
tienen
who
algún
have
grado de incidencia
representatives and
en
offices
que,
in each
digamos,
jurisdiction,
se
and they
cumplan, digamos,
are
los planes de cambio
involved in
climático.
ensuring that
Otros
these targets
700.000,
are
y
fully
obviamente los
complied with.
municipios,
And we
que
also
a
have the
propósito,
municipal
Chile
governments and their
tiene
participation
también una división administrativa
that
de
includes
municipios,
an
y ahí
administrative
son, digamos,
office,
los alcaldes o
and
quien ellos indiquen
the
quienes los representan
mayors
en
then will
estos
appoint
comités.
representatives
Y
to
están asesorados
work
por
on these
consejos tienen
committees.
que estar
They're
participantes
also
también de estos colegios, los
advised
consejos consultivos regionales,
by
y
the
también
regional
están sometidos a los
consultative
procesos
groups,
participativos de la ciudadanía.
in addition with citizens groups
Dicho
that
eso,
will be providing their
para
input
explicar un
and
poco
advice.
más
Now, to
lo que es el
explain
equipo interministerial para el
a
cambio
little bit of the
climático,
inner workings
como les
of the
decía, está integrado por el
interministerial
Ministerio de
technical
Medio Ambiente,
teams working on the environment.
También definido en la ley,
And
en
this is
su
also
artículo
stipulated
23,
in Article
que indica
23
que
of the
equipo
framework
interdisciplinar,
legislation,
digamos, dentro de sus
stipulating
funciones está el
that
analizar y
the
proporcionar
responsibilities
información,
and functions,
digamos, y aquí es muy importante
and
hacer
it's
a
also
través de reportes,
essential
desarrolla propuestas de
that
acciones
we
y
look at
es también, digamos, un
the
actor muy importante
the role
para poder
of
hacer
the
los, digamos, todas las
Ministry of
definiciones y
Health,
los
working
acuerdos
with the Ministries of the
interministeriales
Environment,
y digamos, para también poder ir avanzando en los diferentes planes de
this
adaptación.
enables
y de
making
mitigación al cambio
significant
climático.
progress in responding and to the mitigation efforts.
Bien, y dentro de lo que,
Within,
continuando un poco con la gobernanza,
just to
el Consejo
continue
Nacional para la Sustentabilidad,
addressing the
Adaptación
governance
y Cambio
aspects
Climático,
in
tiene
the
una
area of the
representación
National
muy,
Council
muy
for
variada.
Sustainability and
Está
Climate
representada
Change,
por
we see a
científicos de
wide
campo, tanto
diversity
por
of
el Consejo de
stakeholders.
Rectores de las universidades de
We have,
Chile.
for
Ahí
example, the Council
tiene dos
of
representantes.
University
Hay representantes
Deans
de
and
organizaciones
Authorities.
no
We
gubernamentales sin
have the
fines de lucro
NGOs also
que
involved,
tienen como tema principal,
and
¿cierto?,
their
aportar al
main focus
digamos, a la adaptación y a la
is to
resiliencia al cambio climático.
support efforts aimed at
Representantes
climate
también,
change and
¿cierto?,
resilience.
académicos independientes que
We
estudian
have
el cambio
independent
climático, representantes
academic
empresariales, en especial del
institutions, as
sector
well as
energía,
members of the business
representantes de
community,
trabajadores,
the energy
y ahí
sector representatives,
está
unions,
representado por la organización sindical más
the
representativa del
the
país,
most representative
un
trade
representante
unions
de la
are
Presidencia
also
de la República
involved.
y
We
de
have a representative
representantes de
from the
organismos de
president.
jóvenes. Como ven,
And as you can see,
si queremos lograr cambios
if we want to make
para
meaningful
adaptarnos y poder
change
mitigar el cambio
in
climático,
adapting to
el Consejo Nacional
climate
para la
change,
Sustentabilidad y el Cambio
the
Climático
National Council
tendría
for
que dar
Sustainability
respuesta
and
a
Climate
nuestro
Change
principal objetivo,
needs
porque
to
lo que
respond to
queremos
the
es
key
crear conciencia,
objectives. We need to
crear
raise a greater
responsabilidad, y para eso
awareness
necesitamos a todos los sectores
regarding our
involucrados,
responsibilities. We need
y
to
un
involve
ejemplo de ello es que esto
all
está nominado en la
stakeholders
ley y se está
as
dando
stipulated in the
cumplimiento
law
a ello
and
con
ensure compliance
una
with
amplia
a
representación
broad
de diferentes sectores
representation
que
from the various
tienen,
sectors
digamos, acá, digamos, voz
that
para poder opinar y poder
will also provide
asesorar.
their inputs
El
and
Comité Científico
advice
Asesor del
in
Cambio
the
Climático,
process.
como les
So we
indiqué,
have the
son científicos de
Scientific
diferentes
Advisory
universidades
Committee
que
on Climate
tienen,
Change,
digamos, la responsabilidad
involving
de
also
asesorar
the academic
a,
community
digamos,
that
al
is
MIC y al
responsible
Ministerio de
for
Medio Ambiente
advising
para
to
tomar
the
las mejores
Ministry of
decisiones
the Environment
basadas en
in order to
evidencia
make well-informed,
y el equipo
evidence-based
técnico interministerial de
decisions.
cambio climático.
Then we also have the
Y están definidos
Interministerial
como
Technical Team on
organismos
climate
vinculantes y
change,
responsables de actividades para los diferentes
responsible for the various
acciones digamos, de los
actions
diferentes ministerios
of the various
eh,
ministries,
en sus dependiendo de,
depending
digamos,
on
de qué ministerio tiene cierto a
the
cargo un plan.
the
En el
plans
ejemplo de
tasked
nosotros, del Ministerio
to
de
the
Salud, hemos
various
definido nuestros
ministries.
organismos
And with
coayudantes y
the
responsables de
Ministry of Health, we
actividades.
also include various cooperating
Bueno, el Ministerio de
institutions.
Medio Ambiente en primer lugar,
And those
el
involved
Ministerio de Obras
include
Públicas,
Ministry of the
Ministerio de
Environment,
Energía,
Public Works,
Ministerio del Interior y
Ministry of
Seguridad Pública a
Energy,
través de la
Ministry
Subsecretaría de
of the
Desarrollo
Interior and Public
Regional. Es muy
Safety.
importante porque es
It's
quien
important
tiene
to mention that
digamos, la conexión directa con las regiones.
there's
El
that
Ministerio de
direct
Hacienda,
connection
importante
by the
por
Ministry
digamos,
of
el
the
tema
Finance
presupuestario,
with the
por razones
local
exteriores,
jurisdictions. This is
Ministerio de
crucial in
Ambiente,
terms of the
y así otros
budget
ministerios como Vivienda,
allocations.
Educación,
Then
Economía,
we also have the Ministry of
digamos, y
Education,
Ministerio de Agricultura, Ciencia y Tecnología
Agriculture,
y otros servicios que son
Economy,
importantes
and other
poder lograr
agencies that are
que se cumplan
considered
todas las metas que
crucial stakeholders.
nosotros, ¿cierto? Nos hemos propuesto lograr para
that
tanto adaptarnos como mitigar el cambio climático.
focus on climate change adaptation and mitigation
Dicho
efforts.
eso, podemos decir
So,
que nuestros
having
proyectos,
stated all this, I'd just
estamos en
like to
fase de
point out
proyectos,
that we're still at the
tanto en el plan
project
sectorial de
and
mitigación y plan de adaptación al cambio climático.
the
Ha
initial phase of
pasado,
the
digamos,
mitigation to climate change, and
hartas
our
etapas
sectoral
ya
plans
para
include
poder llegar a lo
various
que estamos en estos minutos,
phases culminating into the current
¿Qué son los procesos ya de
processes.
valorización de estos
We
proyectos
have, for
para
example,
poder presentar, digamos, al
various
Ministerio de Medio Ambiente, que es
initiatives that
el
have been
Consejo
submitted
Directo
to the
para
Minister
la
of the
Sustentabilidad?
Environment.
En el caso del plan de mitigación,
When we look at the area of
estamos
the
ya, digamos,
mitigation plan,
se elaboró un proyecto que
a
se
proposal
conformó en
has
el
already
Ministerio de
been
Salud,
developed.
también un
The
comité
Ministry of Health has also
operativo en
created an
donde
operational
un equipo
committee,
ministerial y de otros ministerios
and other ministries
estuvieron arduamente
were
trabajando en ello y
working
compararon las medidas
together
de
in this
mitigación para la
effort,
emisión de gases de efecto invernadero
looking at,
que
for
son
example,
atribuibles
efforts
al
to
sector salud,
reduce
tal
greenhouse
como tal como lo
gas
dijo Marco.
emissions.
Efectivamente hay
And
una
as
parte de infraestructura,
Marco
pero la
mentioned in
parte,
his
y como lo dijo también
presentation,
Ignacio,
and
los
Ignacio also
procesos
pointed this out,
en gran medida también
there are
que llevamos a cabo en
processes
salud son
that are
digamos,
implemented by the
un
health
gran emisor de gases de efecto invernadero.
ministry, since
Y
that
para
is a
eso, este
sector
plan
responsible for
está, digamos,
significant
atribuido a
release
medidas
of
asociadas a
greenhouse
esto, digamos,
gases.
a este sector. Se
And
establece medidas de mitigación con responsabilidad
we
también de otros sectores.
look at
Y por eso es muy
mitigation
importante el
efforts
trabajo interministerial e
contributed by other
intergerencial para
sectors.
poder desde el
We
proyecto
have
generar
a
los compromisos necesarios para
interministerial
lograr
group that is focused
las
on
metas propuestas.
addressing
El
these and making
anteproyecto
sure these commitments
fue
are fully
aprobado
implemented.
por
This has been
resolución
formally
que
approved
está, digamos, disponible
by
ahí el link para que la
a
puedan conocer.
resolution
Nosotros
that
tenemos
the content
un
is
portal
available.
político
All you just
público donde están
need to
todos datos
do
de
is
información
connect to
asociada a
this
todo el
link.
proceso. Luego se publicó en
And
Diario Oficial,
then we also
se
have
estuvo en
in
consulta ciudadana y ahora
the
estamos en la
congressional
fase que ya
register,
se revisaron todas
we
las
have a
propuestas.
publication. All
El
of the
equipo
proposals have been
interministerial para el
published
cambio climático, para la
in the
mitigación
official
del cambio
Gazette.
climático ya revisó, está ahora
The National
valorizando,
Plan on
estamos
Climate Change,
generando
again, has
estudio de
been
costos
revised. We're
para
now
poder
developing a
informarlo
cost analysis that
al
will
Ministerio
be
de
then
Hacienda y al Ministerio de Medio
submitted
Ambiente.
to the Ministry of
Y en cuanto al
Finance.
plan sectorial de adaptación al cambio climático,
Then
muy parecido, digamos,
there's
del
a
estado en que estamos. También se
similar
conformó
situation currently
un
with the
comité
National
operativo,
Council
pero
on
aquí
Sustainability. They've
el de
established a
adaptación tiene una
committee,
diferencia con el de mitigación. El de
with
mitigación
the
es
difference being
intersectorial este
in
comité
the
y el
case of the
comité de
climate
adaptación
mitigation
es con diversas
process.
instancias técnicas del
Here
Ministerio
we
de Salud.
have technical
Eso sí,
staff and
con
scientific
digamos,
advisors
con un
involved.
trabajo que ha sido acompañado en todo
This
su
effort
proceso por el Ministerio de Medio Ambiente.
has been supported every
Se
step of the
incorporaron
way
también medidas de
by the
adaptación.
Ministry of
También estuvo, digamos, fue aprobado el
Adaptation
anteproyecto, se publicó en el Diario
and the
Oficial y se
Environment.
remitió el
And
anteproyecto también al
the
digamos, y ahora tenemos que remitir
proposed
el anteproyecto al Consejo Nacional para la
legislation has
Sustentabilidad y el
now
Cambio
been
Climático.
submitted to the
Y
National
estamos
Council,
también,
and
ya terminamos la consulta
we
ciudadana,
already
se terminaron de
completed
revisar
the
todos los
citizen
aportes y las
consultation
observaciones
process,
y también está en un
and
trabajo de
we are
valorización de
now
todas las acciones.
we are reviewing all of the actions undertaken and proposed.
Solo hacer un
I just wanted
revisar hacia
to
atrás para que podamos
just step
comprender el
back a
proceso
minute
actual.
so that we can get a better
El plan de
understanding of the
adaptación al cambio
current
climático del sector
scenario.
salud previo,
The
digamos, del 2016 al
Climate Change
2021,
Adaptation Plan,
tenía tres pilares
again, in
básicos.
2021 comprised these three
Uno que era la
key
creación de
pillars.
capacidades
The first one
para
involving the
poder contar
creation
con
of skills and capacities,
un equipo de salud que estuviera
creating
interiorizado en la
a
materia de cambio
team
climático y de los
from the
impactos ante
health
la salud.
sector that
Para
looked
ello se
at
generaron
the
diferentes
impacts by
capacitaciones,
climate
cursos
change
en
on
línea,
health. We had
cursos
online courses
presenciales.
that were
Y aquí lo que
provided
tenemos que hacer es
and
ponerlo
other
sobre la agenda y no sobre la
awareness
agenda
raising
solo de quienes están en el
tools,
nivel de
not just to
gestión,
have
sino
this
también en el nivel
as a key
operativo.
priority on the agenda,
Fortalecer la
but again, to raise
institucionalidad,
that
por lo tanto, el
awareness. Also
2018
strengthening
se crea en el Ministerio
institutions.
de Salud la unidad de
The
coordinación
Ministry
ejecutiva
of Health
del cambio
created
climático
an
encargada de
executive
articular y dar
coordinating
seguimiento a
body
todas estas acciones del plan.
that was
Esta
charged
unidad
and
está
with
ubicada en
coordinating
el Departamento
these
de
efforts.
Gestión del
This is
Riesgo de Emergencia y
a
Desastre.
part
¿Por
of
qué?
the disaster
Porque
management
el cambio
and
climático
risk
nosotros lo
management and
entendemos como una
mitigation
amenaza y que
office,
es una amenaza
because
que
we
cada
consider
vez
this to be
va a
a
generar
threat that
mayores eventos
increasingly is
climáticos
going to
que
generate
puedan,
more and more climate
que puedan
events.
traducirse
that
desastres o catástrofes
could lead
y que
to
estos podrían
catastrophic
ser mucho más recurrentes.
events
Y
and
además
that are more frequent.
tenía un ámbito de generación de conocimientos
Also,
donde
we have the
se
pillar
trataba
focused
de
on
también
generating
poder
know-how
revisar,
and
digamos, todas las
knowledge,
variables ambientales que
looking at the
tuviéramos
current
y que pudieran
environmental
afectar a la salud de las
variables
personas. Bueno, ahí hay
that
una
could
foto de,
impact
digamos, de un
human beings.
mosquito.
And here we have a photo of a
Nosotros en Chile,
mosquito
si bien
biting someone.
la única zona endémica
And
donde hay dengue es
the
en Isla de Pascua,
the
pero
only
para
area
nosotros
where
es una preocupación. Ya tenemos
these
reintroducciones
diseases
de
are
agentes
endemic
parasitarios
are
en
the
la región más
Easter
caliente del
Island,
país. Y
and
además tenemos
we
presencia, hemos
also
tenido hallazgos de Aedes aegypti
we've
en una
seen
región
Aedes
mucho más
aegypti
céntrica del país, en
present
la
in
región de
the
Valparaíso, que sería
central
lo
part of Chile,
céntrico.
principally in Valparaíso.
En cuanto a los
Now,
contenidos de
let's look at
ambos
the
planes,
content of
los
both
actuales,
plans.
se,
In the current plans,
digamos, los grandes pilares de estos planes
these are the major
tener un
pillars.
diagnóstico sectorial de mitigación,
We start off with
describir las
sectoral
medidas de mitigación,
diagnosis, looking
describir
at
las medidas de los medios de
descriptions
implementación
of
de esta estrategia
interventions
climática a largo
and
plazo y generar
long-term
indicadores de
responses to
monitoreo,
climate
de
change,
reportes y de
monitoring
verificación.
tools,
Eso
as
es como
well
lo
as
vamos a ver en
verification
detalle. Nosotros dentro de
efforts. And
de
within
link que les proporcionamos en
this
las
link that we are providing you
anteriores,
in the
pueden
previous
acceder
slides,
a toda la
you can
información y todos los
access
procesos que
all
hemos
of the
ido llevando
content
para
and
poder llegar a lo
processes
que es este plan
that
de
we
mitigación.
developed culminating in
Y en
this
el cuanto al
mitigation
plan de
plan.
adaptación,
Now,
la
looking
verdad
at the
que
adaptation
si
plan,
volvemos más atrás a la anterior
if we
lámina
just
de
step
los tres
back
grandes
to the
pilares,
previous slide, looking at the
se nos
pillars,
incorporan nuevos desafíos
we've
que están
seen new
incorporados en este
challenges that
anteproyecto
have been
y incorporar
incorporated,
la acción regional en la adaptación al
and
cambio
we've
climático
incorporated
y
regional
una mirada
responses
territorial, no
in
solo macro a nivel nacional, sino
adaptation of the
territorial,
health sector to climate
incorporar el
change.
enfoque de cambio
We've
climático en todas las
incorporated
instancias
also
técnico-administrativas
the
del
climate
sector.
change
Es
approach at
importante
all
que
of the
esté
administrative technical
incorporado y se
levels within the sector,
transversalice en los programas
where we are
que tiene el sector salud,
developing
incorporar el enfoque de
the
género
health
en la adaptación al cambio
response,
climático. En
incorporating
eso
also
hemos estado
gender
trabajando con el
approach
equipo
in
de
adapting
género del
to
ministerio,
climate change,
abordar los efectos del cambio
addressing
climático también en la salud mental
specifically the effects of
y cómo
climate change on
focalizamos,
mental health, and
digamos,
also looking at
acciones de
how we
vulnerabilidad a
can
esta
target
amenaza
actions
climática
according to the
y tenemos como
vulnerabilities
pertinencia
that are
territorial y
associated with
obviamente
climate
al decir
change that are
territorial no
specific
estamos
to each
dejando de lado lo
jurisdiction,
que es la pertinencia también cultural, teniendo en
looking at also the
consideración la
cultural
multiculturalidad que tenemos en
issues
nuestro
that
país.
we need to tailor to each one of the
¿Y qué
responses.
diferencias hemos
Now, what
tenido
are
si
some of
queremos
the
comparar nuestro
differences if we
proceso de elaboración de
compare
plan sectorial de
the
adaptación
sectoral
del
plans
2016 al
from
2024? Lo
2016
quisimos
in
mostrar en
adapting
una
to climate
balanza
change to the current one?
en
So we
cómo
tried to
hemos tenido que
balance these and
trabajar.
see
Sé que el
exactly
equipo igual ha
how
estado
they have done so
sobreexigido, hemos
far,
tenido que cumplir algunas
looking at
acciones,
the
digamos, por la ley que nos
completion
pone plazos
of
bastante,
specific
digamos,
targets
acotados.
determined by the
Pero el
law.
primer plan fue
The
realizado por una
first
consultora
plan
externa que estuvo a
was
cargo de su
carried out
elaboración
with external
y elaboró este plan
consulting
climático de
bodies
salud,
that were tasked
realizando
with its
reuniones,
implementation.
consultas, entrevistas
There were
con expertos
meetings
sectoriales.
with the various
Pero este nuevo
representatives of the
proceso, y
sectors
eso es
in this
lo
new
que enriquece
process. And
al
this is what I
proceso,
think has enriched the
este
process
plan
further, is that
climático
this
de adaptación al
climate
cambio climático
change
del
and
sector
adaptation plan by
fue una
sectors
elaboración con el equipo
was
sectorial.
developed
Por lo
with the
tanto,
sectoral
también
teams,
ahí
and
ha
as a
sido un
result,
trabajo
it's been
de mucho análisis, de
an
mucha
effort
discusión y de
involving a
ver
great deal of
cuáles son las
analyses,
metas que
discussions,
podemos
and looking
incorporar de forma
specifically
realista,
at the
también
various
con la
methodologies that
responsabilidad que
can
nos
be
compete al
used,
sector
and
en
also
relación a los
with
efectos que puede tener el cambio
looking
climático en la
at
salud de la
the
población, qué es
responsibilities
lo
of the
que el
sectors in
Ministerio de Salud
responding to
debe
climate change.
realizar,
For example,
cuál
what
es,
should the
digamos, lo
Ministry of
que
Health
lo que el
prepare?
Ministerio tiene como responsabilidad
What are
también
the
por el
responsibilities,
deber ser del Ministerio en forma legal
legally speaking?
y también el
How must
trabajo
they
con estas
respond?
instituciones coayudantes que se
Also,
han ido
working
invitando a
with
trabajar
these
desde el
other
inicio
agencies that
del
are
proyecto,
involved
lo
in
que ha
the
generado
intervening agencies in developing the plan.
una muy buena experiencia
We've had some very
en el primer
positive
plan de adaptación al
experiences
cambio climático
compared with the first 2016 plan, where we had more of external consultations, but there was not significant participation by these cooperating agencies, and there were some challenges in implementing the plan 100%. So we hope that by meeting the goals and targets established in the plan, since they've already been very amply discussed by the various stakeholders and implementing agencies, we're hoping that we're going to see a more comprehensive implementation, including citizen inputs. That has been a measure that was very timely, where we've had a significant level of participation by the citizenry, the members of civil society, and this has given us a greater understanding about the fact that this is a priority, not just for the public sector, but also the entire citizenry. So we've been able to create a greater awareness and understanding about the scope of the risks associated with climate change and other impacts that can have an impact at a countrywide level. So the fact is that in discussions, again, together with Ignacio, we've been able to carefully look at the inner workings of the whole process of developing the plan. And in terms of adaptation to climate change in the South American region, and with meetings with other international organizations, we've seen how some of the experiences have been in terms of responding to climate change impacts and health. The first plan, again, did not achieve the level of completion that we had hoped for or expected. This was a very far-reaching and significant effort, and so this time we're expecting much greater results as we continue through 2030 to meet the SDGs, and these are elements that are very much in consideration in our efforts to combat climate change. Well, thank you. I think we're reaching the end of our allotted time. I know there's a lot of questions, and the webinar presentation, by the way, will be available on YouTube, and we'll be able to respond to the questions that were posted. We have more than 40 questions that were posted. I'd like to offer the floor to my colleague, Mariana Alfonso, from the Climate Change Office from the IDB, and we'll also have some words from the Social Sector's Office. So, Mariana, you have the floor.
Thank you, Ignacio. Thank you, Paula. Thanks, Margot, for excellent presentations. As Ignacio said, we have a lot of questions. So if you could answer in just 2 or 3 minutes, just at least one that of all the ones received, that I think refer to the importance of territorial landing, if you wish, regional, territorial, municipal, of the National Adaptation Plans in the health sector. But how do we see that related to the strategic planning regionally? And is a strategic adaptation plan regionally possible, considering the migration of people from one country to the other, which is one of the possible consequences of the climate change. It could be an increase in the migration. So how do you see the importance, or maybe the need to plan in the health sector at a regional level beyond the national borders, I mean? So first Marco and then Paola. And I appreciate it if you can be very brief, very abstract, because we have very little time.
Yes, Mariana, thank you for the question. A phenomenon we have recently seen here in Brazil is climatic migration of the populations. That some populations are leaving their regions because of the drought, because of the drying up of the rivers. They are going to larger centers, and these larger centers are not able to look after these populations, these climatic migrants that are arriving in cities and towns. The issue of planning is of the essence, and as a possible solution, we are conducting an assessment. Our adaptation plan to climate change in the health sector was submitted to popular consultation because it has several indicators. But what you said is absolutely right. Many of those indicators may not represent impact at local level. Sometimes they are only at macro level, federal level. So we have some 2 weeks ago, we have submitted this planning to the assessment of the population at large. It is available on the site of the Health Ministry, and we have received several recommendations for changes in the indicators so that the indicators do better mirror adaptation at state level and at local level, so that they can reach out to these vulnerable populations at local level that are almost invisible in a macro framework. Thank you, Marco.
Paola.
Thanks, Mariana, for your question.
And nationally, we also have regions that have been moving due to forced displacement due to the water absence. But I think that as a region of the Americas, in answer to your question, Chile participates in the Andean Hipólito Uninae Orozcono group, where as part of the different work that we do, we have the GT on disaster changes and climate change. And we've developed a climate change plan regionally where we were able to see some similarities in the 6 countries that are part of this Andean Committee. And also working with the Pan American Health Organization, we have had different transfer of experiences with other countries that are not part of this Andean group. And we've also been able to see there, and have also been part of consultation with the Pan American Health Organization to see how we can work with climate change and health. Just in answer to your question. Thank you very much. I think that we have no more time left. But one of the things I did want to highlight, and Paola mentioned it in her presentation, today is the Day of Mental Health. Well, it's a month of mental health. It's a topic that is very important to consider in the healthcare planning, the impact climate health will have climate change will have on mental health, with post-traumatic disorders due to extreme climate changes, or what's also known the econicity, which are actually the reactions people can have simply to the threat of climate change. And that is also important. Thank you very much for bringing that up today, which is the day of mental health. I'm now going to give the floor for the final remarks to my colleague, Soledad Bosch, who is advisor in the social sector of the bank, coordinating the green social agenda, which considers the biodiversity as an impact on the social sector. Soledad, thank you. Thank you, Mariana. Thank you all very much for your presentations today. It was really a very interesting topic. And I want to close with 3 lessons learned from these presentations. First, climate change is a serious threat to the human health in Latin America and the Caribbean. We saw that in Brazil, the heat waves, the patterns of disease are having impact on nutrition and access to water. Secondly, we have to begin to work urgently to reinforce the health system so that they can face these climate changes, to respond to the greater and newer demands that are arising in the health system through the climate change, as well as to continue to operate in the presence of climate emergencies that prevent access and actual services. And finally, the number 3 is that there are successful experiences in the region. We just heard what Chile's done and what Brazil is doing, and showing that it is possible and what should be done to plan and to act in the health sector. We just heard that one of the key things is to have a strategic vision in the health sector, to frame it in clear roadmap with the climate change commitments. We've heard of the Plano Clima in Brazil and the one in Chile, and they show the climate decisions and then how it is brought down to all the different health sectors, to have the necessary installed capacity in the government in general, as well as in the health sector, so that one can actually achieve the appropriate governance in the teams within the health ministry that will generate these plans for adaptation to climate change in the health sector, as well as the ones who will be actually implementing these actions, and ensure ourselves that all investments made will allow us to respond to these new and greater demands of climate change. Someone mentioned the climate medicine in Brazil, which I thought was very interesting. And we also must continue to operate continuously in the presence of extreme climate changes. This morning we woke up, I'm here in the United States with the news of the Milton hurricane. And I was seeing one of the hospitals in an area in Florida where they had put some contention bars so that the hospital could continue to work despite the water going up. So it's key for us to be able to make the necessary investments, but always linked to appropriate planning and a planning with the health ministry so that they can actually be implemented. So let's get to work so that we can actually respond and prepare these responses, and the health sector can actually face the impact of the climate change. I'll end by thanking all of you who joined us today, and thanks for your time, and for the presenters, thank you for your time as well. And thanks for telling us your very interesting experiences in Chile and Brazil. And hopefully you've learned something, and we're more inspired to generate new actions and collaboration and find innovative solutions. I'll leave you here. We'll see you soon. And thank you for joining us.